Okay, so welcome to this event that is focused around good practices exchange. As you may know, the Reference Site Collaborative Network focuses on fostering the knowledge exchange at different level of maturity for good practices, innovative good practices. And we think that training is a powerful enabler for the transfer of good practices. So this is why we decided to valorize the knowledge that has been developed by TEAMCARE project and give a special perspective to this meeting. So look at how the knowledge and training has been an enabler in different European environments.
Good morning, everybody. I'm Jan Illing. I'm Professor of Health Professions Education at RCSI University of Medicine and Health Sciences, and we're a partner on TEAMCARE. And for the start of it, I have been the PI. So basically, it's an Erasmus project, and we are aiming to work together with 12 partners across Europe. And those are the main countries: Ireland, Italy, Greece, Poland, Belgium, Austria. And we have many other healthcare members, particularly from Italy, joining us to develop this new curriculum. It's aimed at training community-based health and social care staff to work collaboratively for the benefit of patients and service users. So the background is actually surprisingly, many of you will be aware, of course, that when you train as a doctor or a nurse or a physio, you go on your course and you learn about that, but you don't learn about other members of the team. And people largely work on their own in silos rather than working as a team. And for the service user, for the patients, it's incredibly frustrating because they're retelling their story, the service is not connected, and it leads to a lot of dissatisfaction. But we know now, over the years, that there are many, many benefits from working as a team.
We wanted this to work across all these countries. So you can see we've broken down here into micro-credentials. The education solution that is micro-credentials is it divides education up into small packages that people will do when they need to and be able to build them together to ultimately gather the whole curriculum.
So, what are we doing right now in Italy, and what have we done actually? Since we had to design and localize the EU curriculum inside Italy, the first step was try to work on this localization, trying to use the flexibility tool which has been created by a partner of the consortium, which is C4Life. And thanks to this tool, we could balance the ECTS, so the credits, educational credits inside the Italian pilot.
In Polish system of healthcare that we need the teamwork, that we need the multidisciplinary approach to the students, and we've got many testimonies from our students that it's not used. So maybe it's not the Eureka, but it's like showing the need of the studies that we have really, our students have many hard skills, but they usually lack this communication, this soft skills, this transversal skills. So I think it's really positive, and it will be probably shoot on our videos after the project ends.
So good morning, everyone. I am Dr. Cleo Kudra. I'm Associate Professor in Social Work and Public Health. And the TEAMCARE project teams is structured around a central coordination group responsible for the academic literacy, implementation and certification. But nothing will have been done without the trainers. We have 6 trainers delivering the program, and here is a photo of them. So thank you, this is all for me.
My name is Geraldine Regan, and I work with the Royal College of Surgeons in Ireland, and I'm the pilot coordinator for the project. and I have maybe about 30 years experience in practice and about 15 years of experience in universities overall. So, so just to start, our Irish pilot, we have four micro-credentials. We've completed the first 2 of the micro-credentials, and the third micro-credential is in process at the moment. We recruited 13 teams. We have working with patients in community-based team care. We have digital health in community-based team care, and we have culture and communication. So our learning outcomes are distributed across these 4 micro-credentials. So some of the challenges we had, and like Bernadetto in Italy, we had the challenge of the digital engagement by participants. So the next steps for team care in Ireland, the pilot evaluations are ongoing, and we're looking at our own evaluations, and then we'll take corrective action and develop plans for maybe a team care project going forward next year. Sustainability for continuation of the team care micro-credentials, including a roadmap to train other professionals